All right, let's now bring in Dr. Lesley Bamford. She is a child health specialist and COVID-19 coordinator at the National Department of Health. Doctor, a very warm welcome to you. Thanks so very much for being with us here on SABC News this afternoon.
Good afternoon, and good afternoon to the viewers.
Doctor, tomorrow is, of course, the 1st of December, and I understand that the department has had a certain goal, of course, to reach a number of the people vaccinated by December. It seems as though that goal hasn't, in fact, been reached. What more will government be doing in terms of, in aiming to reach that particular goal?
So our target initially was actually by the end of December, not the beginning of December, to reach 70% of adults with at least one dose of the vaccine. As you correctly point out, it is unlikely that we will meet that target. And we must again stress that this is because of hesitancy and poor uptake of demand, or uptake of vaccines, rather than the fact that we do not have enough vaccines or that we do not have vaccination sites that are operating. So we continue really to urge people to come forward and to be vaccinated. Some complacency has crept in with the low number of COVID cases. But we really would urge, as I say, people to come forward and be vaccinated. Now is a very good time to be vaccinated. There are some indications that the fourth wave we know that at some point we will have a fourth wave. And so the sooner that people get vaccinated, the better.
Doctor, what's the hesitancy you speak on based on? I'll just give an example of what I mean in terms of my question. I mean, is it based on the fact that people are perhaps saying that they're worried still about the side effects? I saw on social media, on Twitter, people were talking about, listen, I got sick when I got the first jab, and then I just didn't want to go for the second jab, for example. And I wonder if that's also adding to that hesitancy, or are we talking about just the hesitancy based on the first jab to begin with?
So I think we understand that some people do have some legitimate concerns around vaccination. They might be fearful. They might have had some mild side effects after the first jab. What is very concerning, however, is when vaccine hesitancy is based on misinformation. And there does certainly continue to be a lot of misinformation regarding the vaccines that continues to circulate. So really, as government, but also with our partners, with civil society, with trade unions, with society at large, all we can really do is provide people with accurate information. And really, there is overwhelming evidence that the vaccines are safe and effective, and encourage people to come forward and be vaccinated. We know that many people do suffer mild adverse events after vaccination, but these can be managed and resolve very quickly within 24 to 48 hours. A very small number of people do have more serious adverse events, but again, we are monitoring those very carefully, and those adverse events can be managed, and people recover from those adverse events.
All right, I want to find...
So
sorry,
we
Doctor.
remain very confident that the vaccines are safe and effective. And really it's up to people to come forward to be vaccinated.
All right, sorry for interrupting you there, but I just want to find out how our hospitals are doing at this stage. We're going into December, and we know that generally the hospitals in December tend to be a little bit overwhelmed, and particularly if we're talking about the government hospitals. I mean, it's this time where people party, all sorts of things, there's injuries, and of course we've heard that the hospitals do tend to get overwhelmed. At this time, how are the hospitals actually doing? And maybe it's important to also discuss, in terms of the people that are in hospital due to COVID-19, due to coronavirus, how much, if there's a percentage of those or number of those, I wonder if you'd have that offhand, but how many of those are unvaccinated people and how many of them would be vaccinated people?
So I don't have the figures in front of me. We do know that the majority of people who are admitted to hospital, people with severe COVID infection, particularly those requiring ICU admission, that most of those people are unvaccinated or partially vaccinated.
Yeah.
So not yet fully vaccinated. We are hoping soon to have those data to be able to release them more timelessly and on an ongoing basis. But experience from around the world does show that the majority of severe cases are in unvaccinated people. And that situation is exactly the same in South Africa.
Oh, all right. Thank you very much, Doctor, for speaking to us. And we certainly do appreciate you giving us your time here on SABC News as always. Thank you.